The work requirement's a good balance between our compassion to help those that need health care coverage and the simple responsibility that if you're able-bodied, you should be working or being trained or volunteering. And so it's a good balance. We're working hard to make sure everybody's aware of that requirement, to emphasize the compliance. Those who have been left off of coverage because they didn't comply with the work requirement will have an opportunity now, January 1, to re-enroll. And so this is a consequence that we have for not complying with the work requirement, but we want them to move to work, we want them to get that work, we want to help them to be able to get the training they need. First of all, in every which way, we've actually had a contractor that actually calls the Medicaid recipients and say, make sure you're aware of the work requirement, can we help you to comply with that? So we're outreach to them as well as the provider and insurance community, but then we also made it easier to comply by they can walk into the DHS office, they can do it by a telephone call, or they can do it online. So it's not simply an online requirement, there's multiple different ways that they can comply and report their work requirement. Many of the young people in that category, one, are healthy by and large, but secondly, they're going to school, so it's easy to get an exemption, or they're in training, or they're working. And so if you're able-bodied in that age group and you're not complying, then there's not any reason for it. And so we expect a good level of compliance from that age group, but it's important when you get a social benefit that you exercise that responsibility. Well, we're really not reducing Medicaid spending. Medicaid spending continues to grow really every year because of rising health care costs, but we're trying to control that growth of Medicaid spending. And so we're not reducing services to people, we're trying to manage it well, we're trying to make sure that we're operating efficiently, fairly, meeting the needs of our citizens, but there has been some changes in rules that have to do some adjustments because whenever we see we're the highest in the region for one level of reimbursement, we have to make some adjustments. So those are just changes that are needed to manage the cost of that program. Those that are on disability, those that need home services, those accommodations are made, and encourage them to work with their DHS office and their medical care provider.